you doing? I'm here for my shoulder.
Okay.
You gave me a shot about 5.5 years ago.
5.5 years ago, and it's been good all this time.
It's been good all this time. I'm feeling a little twinge now, not too bad, but before it turns into something more, I think I get a tune-up shot.
So you're having mild discomfort, pain in the right shoulder.
Yes.
And the way I look at it is, it affects your arm swing, and because it's going to affect your arm swing, it's going to affect your gait and can lead to other problems lower down.
That's it.
And that's why we do that.
That's it.
You don't want to have back, knee, ankle, or foot problems develop because your arm swing isn't even like it's supposed to be.
That's it.
People don't realize that the whole body is connected. All right? We don't live with separate parts. You don't hang your arms and shoulders up at night when you go to bed in the closet.
No.
Okay? So your body parts are all connected, and if they're not in proper alignment, then you're going to eventually have a problem.
That's it.
Okay?
Yeah.
So that's what Prolo does, just as a reminder of some of the basics around it. It's a local injection. We put in a little local anesthesia with a touch of methylcobalamin, which is a very special, healthy B12.
Mm-hmm.
Then we disconnect that, and then we push in the oxygen and ozone gas at a special concentration. Now with shoulders, we find where we need to go by doing a muscle test.
I remember
Muscle strength test. That's how I know exactly where to go without having to use guided ultrasound like a lot of doctors who don't know how to do the muscle testing.
Right.
It's one shot a week until you're a 0. Today you're a 10. As mild as it is, I still call it a 10. And we want to get you to 0. And since we had you at 0, I expect to achieve 0 again.
Yeah,
okay.
I came in and I couldn't lift my arm past my waist. And I was like that for 7 months. And I said, I was lifting weights, hurt my shoulder. And I couldn't lift my arm. And I said, hey, it'll get better tomorrow. Didn't get better. It'll get better next week. It'll get better next month. Next thing I know, 7 months is rolling around. I said, nah, this is way too long. Let me come down here. Let me get a Prolo shot. And I got the shot. And it's hard to believe, but within 30 seconds, I could lift my arm to the ceiling.
Yep. We've seen that more times than you can imagine.
Yeah, it's true.
So it's pretty amazing. And that means even arm swing, even gait, all the body parts start moving the way they're supposed to again. So ultimately, we want to get you to 0. One shot may do it. It may take 2, 3, 4. I've never really gone into what I call double digits on a shoulder.
Right.
I've never had to go that number 10, 11 or more to get it to 0. If you reach a plateau, and after a couple of shots at that plateau level, I'm a 4, I'm a 3 or 2. If you can't get it past it, that means live with it or have a surgery if there is such a thing to do for it. Okay? Those are your options. Pretty easy when done correctly, obviously safe when done correctly. If you have pain after the treatment, you ice it. 10 minutes on, 10 minutes off. Okay? Over a t-shirt. Okay? Directly on the skin might be too cold.
Right.
Okay? 10 minutes on, 10 minutes off. You can take, if you want to be pharmaceutical, Tylenol. If you have pain, most people don't have pain, but I'm just saying you can. Tylenol.
Right.
Or if you like to be natural, arnica, which is a homeopathic remedy for that. We don't want anti-inflammatories because we want inflammation. What's actually doing the repair is your own body. Your own body